Athlete 1 is Greg, who has a sporting background in bobsleigh and prior to that sprinting. Greg was previously coached not to squat to a full range as it wasn't relevant to the performance range of a sprinter. Due to this, Greg has developed some minor skill-related issues. In this first photo, we can see Greg has set with his feet in a slightly uneven manner. This was corrected via a simple audio cue. In this lateral view, we can start to notice some other skill limitations to the squat. Greg has a tendency to lean forward under lower loads. However, this attribute naturally corrects itself under greater loads. Here we can see that the bar has travelled forward over the knees. Normally, this may be due to a mobility restriction. However, knowing the athlete's history and having used both the knee to wall test and the Thomas test, I believe this is not the case. Greg is clearly in a suboptimal position here with his weight in his forefoot and subsequently unable to hit the desired depth of back squat. Greg responds well to visual feedback, so having shown him the videos and highlighted the errors in his movements, we progressed forward. With the additional audio cues of chest up and heels down, we can now see the improvements to his prior skill-related issues. We can also see here how Greg is now able to achieve a far greater range of movement while maintaining a nice neutral spine. Brian is a left lower leg amputee. He also has significant issues with his right foot, having undergone several surgeries due to a club foot. The structure of a joint can be a constraint to a movement that requires smooth articulation of the joint in question. If, like Brian's case, there is no joint, we have a clear capacity issue. In this first video, we can see Brian squatting with his blade, which has zero lateral movement and is designed to propel the athlete forward in a running motion. At the bottom of the eccentric phase, we can see some compression of the blade, which could in future become a loading capacity. The prosthesis has a substantially lower load capacity than a regular lower limb due to its lack of tissue. It is very apparent that Brian has reduced mobility. Brian does, however, achieve the correct skill and function of initiating his squat through a hip break movement. This second clip shows Brian with an alternative prosthesis. This is designed for everyday use and activity. While the prosthesis has severely reduced dorsiflexion and plantar flexion, it is far more stable base for Brian to squat from. When we take a lateral view of Brian, we can start to see that there is also some other limitations to his movements. While Brian can effectively create flexion and extension of the hips, his lack of ankle mobility once again is reducing his range. A knee to wall test highlighted Brian was unable to produce almost any dorsiflexion, and this is visually highlighted here. When comparing Brian's movement with his foot to that of the same movement with his blade, we see reduced mobility and reduced range of movement. This is likely to be due to the compression factor of the blade. Here we have athlete 1 performing a rear leg elevated lunge. He is able to achieve a full range with the left leg elevated. However, with the right leg elevated, there seems to be some issues present. Here we can see the ability the athlete has to achieve the technical requirement of this exercise. The bar is centered over the center of mass and in a balanced position. However, with the right leg elevated, there seems to be some restrictions to the movement. Although this athlete has good ankle and hip mobility, he does have reduced flexion of the foot due to previous injury. This provides a small capacity issue which seems to be limiting the depth of movement. From this front angle, the external rotation of the hip becomes apparent. We can see some slight lateral movements of the patella on the front leg. This can be corrected using a glute band above or below the knee to provide some additional activation as well as a physical reminder to the athlete. Although there seems to be slight instabilities, the athlete is able to maintain a neutral spine. The capability of this movement is restricted due to the athlete's foot. However, if the rear foot was set onto a roller, it is likely to remove this small skill issue and the athlete should be able to then perform the exercise with no limitations. As we are already aware, Brian has some serious capacity issues around both his left and his right leg. These capacity issues also have skills related issues tied to them. When performing the rear leg elevated lunge on his blade, Brian simply cannot maintain balance. Although it's designed to control acceleration and deceleration, the lack of fine motor skills in his supporting leg isn't enough to balance the total movement. From this it's clear that with this prosthesis on, he is unable to perform the task. We can see here that Brian is trying to support himself and subsequently pushing with his rear leg, which is causing the bar to move forward. Following on from this movement, the heels are required to lift off the floor to support. This is due to the lack of mobility at the ankles. With Brian on his more stable prosthesis, the movement begins to look more mobile. However, it is soon apparent that he is leaning through the torso to compensate. Here we can also see an element of lumbar flexion starting to occur. I believe this is down to the athlete's understanding of what is required, but his inability to do so. Brian is unable to produce more than 42 degrees of movement at the hip. This is going to be a large limitation on all of his movements. From this front view, we can see Brian is likely to also have loading capacity issues on his right leg. This is due to the metalwork present in and around his ankle and foot. Although this itself is a capacity issue, I believe there is an element of skill-related issues also present here. Brian is able to perform a reduced range of movement in a stable fashion while standing on his right leg. However, when required to support himself with his left leg, the movement breaks down and he is unable to balance. Brian's upper left leg and glutes begin to exhibit some weakness as the exercise continues. This can be shown by the valgus movement of the knee. This, paired with the zero lateral stability of the prosthesis, is providing too many unstable factors, and subsequently Brian begins to fall off balance.